Some of the challenges that women face in Northern Uganda to accessing contraceptives, one of them is they do not have information about the contraceptives themselves. So you find that lack of information is a limitation to them. And yet there are a lot of unintended pregnancies and there are a lot of teenage pregnancies. And yes, these women would need this information. They would need to go and access reproductive services, but are unable to. We are able to come up with a map that can show contraceptive access points so that a woman or even their spouse, if they are seeing this map, they're able to see which access point they can go to in order to get contraceptives. In this process of developing the map, one, we had to first do research. So we used Kobo tool to be able to go and conduct research within the community and be able to find out what are these challenges, and that's how we knew some of these challenges. Where do people access contraceptives? Do they even know the contraceptives that exist? Which ones do they know? So we got all that information, and then we used that information to be able to come up with a map.
The map has made our work easier in a way that we don't have to go out bringing clients to the facility. Now we have work to do. Many clients are coming, and as they come, the data work has become simpler.
In our map, we decided to have, one, the name of the contraceptive access point. Two, we also put the time, the opening hours of that contraceptive access point. We also needed to include which contraceptives are available at that access point, which ones are free and which ones are not free. And then the location, of course, was already displaying on the map.
Ever since we had an interface with Amara, it has opened our eyes, and it has given us a deeper thought in how much service delivery is needed in the city. We put into consideration, we had so many hidden health care providing facilities that the city didn't even know, but Amara was able to map them out.
Before the mapping project, it was very hard for the community to know where to go, because they used not to know that this is service they are giving in this health center, in this facility, in the pharmacy, in the clinic. So people were just confused in the community. But when this project came, it helped us a lot.
When I came to the facility, because in our facility there is a health talk once in a week, so I had the services that they do. When I came on that specific date, I found that the things, they were out of stocks. So going home, just passing the facility, I saw a map. So reaching home, I picked my bike, I went up to that clinic. Using the map, I was able, when I was riding, to find out that the facility was just close to me.
So we've been able to notice more women and youth being able to go to these access points within the community. And this is because now they have knowledge, now they know where to go, and when they know where to go, they're able to know what kind of contraceptives exist. How this project has contributed to our vision and mission is that as Amara Hub, we are set to serve the community, and one of the main goals we have has been something around digital literacy, financial literacy. So if they have this information, then they're able to plan their families and they're able to provide and work for their families as they should. So all that is promoting dignified livelihoods, and it feeds into what we want to do as Amara Hub, especially for the northern community.